and welcome to the health program on Trust Television. I'm Aisha Salihu. You'd recall last week on the program, we talked about the use of digital solutions in public health interventions, where a representative from eHealth Africa took us around the benefits of such in tackling Nigeria's health system. In case you missed it, you can watch on our YouTube channel and the Trust TV's website. On today's episode of Healthy Living, we're taking the conversation further with a twist of exploring the increasing role of geographic information systems in public health. I have joining me in the studio Samuel Udofia, who is GIS coordinator with eHealth Nigeria, and also on standby virtually is Busayo Fashoto, GIS manager with eHealth Nigeria, to shed more light and further perspectives on the subject. Welcome to the program, gentlemen. Now,
Hi, good afternoon. Nice to be here.
I hope you can hear me. Okay. Now, I'd like to start off with Fatosho in Lagos. You know, we're talking about geographic information system, and for a layman who may not be aware of what this means, I'd like to hear from you. What is your perspective? I mean, what is the meaning of this in its entirety?
You could actually just summarize geographic information system into answering some basic questions of what, where, and why a particular event happened in a particular location. That's yes. To now break it down into the technology terms, is just the process of analyzing and bringing different sources of data together to make sense of what exactly is going on ground. And answering those questions are very, very important to actually make decision. And in light of this reference about exactly well-being of the population, also the well-being of the people around where that event really happened. So that's just basically what GIS is.
I'm hearing information, I'm hearing data, and I'm also hearing how it answers questions of where, where and how. Now, let us bring it back to my guest in the studio. I'd like for you to, just as an addendum to what Mr. Fatosho has just said, what is your take on that?
Okay, as Fashoto just said, geographic information system is just a system whereby spatial data, when we say spatial data, we mean any data located on the Earth's surface, can be collected and then analyzed within the computer environment and then visualized for decision making. That's what geographic information system is all about. Basically helps for decision making.
I like the fact that we're bringing it down to decision making, but this now brings me to my next line of question. Before we move over to decision making, we have to look at the tools. You're talking about collection of data. What are the tools involved in geographic information system?
Well, looking at the tools involved in geographic information system, first of all, you may want to look at talk of the hardware, which are the things we can touch and see, like our computer systems, our mobile phones, our GPS devices, and so on. Then we can also talk of the software. Software is another very major component of geographic information system. And the software is just a set of algorithms which are designed, to run the system, to run the hardware. Then also another basic component of GIS is data. The data is actually what drives the GIS itself. Then you also talk of the procedures, the human way, and then the end users also is a major component of geographic information system, because without the end users, there won't be need for us to use geographic information system.
You talked about hardware, software, the human component, and also how the end users come to play in all of this. Now, I'd like to know, I know you said the tools are also used to store, visualize, analyze, and interpret geographic data, but just so we're not sounding so technological and then we're losing our viewer, now let us bring it back to the health sector. The health sector is one paramount sector that we keep talking about how we can drive data, how we can use data, we can use them effectively to drive policies. But before we go into policies, how do we use this GIS now in the health sector? Let me start with you, Mr. Fatushu.
Yes, basically, it actually starts from benefit of GIS itself and how public health has actually tapped into that benefit. The first thing is accountability. First, GIS gives you that, gives you evidence-based result. So it's not just the kind of analysis that somebody will just bring a paper and this is that is that. No, GIS will give you what exactly is on ground, how it's being done, and how the coverage actually looks like. So that's one thing that GIS, the public has actually tapped into in terms of utilizing GIS in the earth. So aside accountability, improvement in processes and improvement majorly around immunization processes, that again has actually show a lot of impact. GIS has actually shown a lot of impact in that regard, where it shows the number of settlement that has been tracked, different analysis that happen on ground to even drive decisions to identify areas that are lagging behind. That's much more important, areas that are underserved. That's what GIS always point out. Each time you run any geographic analysis, is either it's giving you overserved area or underserved area. So in that space, that is very, very important because you want to achieve universal healthcare system across the federation. You need to understand where is underserved and where it is overserved, and GIS had been the major clue in that regard.
Now, I know that GIS answers the question of where diseases are prevalent, where vulnerable populations live, and where resources are most needed to improve health conditions. Now, I'd like to know, I was at an event just recently, and the coordinating Minister of Health did talk about how we need to take the message down to the grassroots, to the rural communities. You did talk about vaccines earlier. How does GIS now come to play in the areas of vaccine accessibility, also acceptance and usage?
So speaking of the vaccination, actually vaccination process itself, is all boiled down to what we call micro-planning. Micro-planning is planning for the lowest of the lowest. That's the settlement itself. And of course, even from there, you also plan for the children that will actually be affected. That's the last mile. So GIS have been able to, our GIS have played a major role in implementing or in ensuring that those children at that ground or at that level within that locality get the vaccines that they need to get, right? The level of acceptance, of course, can actually be measured across board using GIS also to look at why is this area accepting this vaccine and this area is not. Then, of course, further actions can now take place in that regard. But in terms of resource allocation, in terms of tracking of vaccinators' teams, GIS has actually played a major role in ensuring that no child or no child is left unvaccinated. That's the key. That's the key message to the ground level, right? That is GIS taking it down to the last mile, ensuring that everybody gets benefit from the health services, from whether it's immunization, whether it's different services, maternal health services, whether it is also disease monitoring, as the case may be. GIS ensure that it gets to that last mile, because that's what GIS is preaching. Where is this event happening? Where is this event happening? And once you identify that, you'll be able to mobilize resources and also optimize processes. So it's not just to say that, okay, A is happening at so location, but what are the processes that drive people to move there, right? I don't want to go technical. The network analysis also help us to even optimize where we should visit first against some other areas where exactly are these process needed, or where are these vaccine needed more compared to other areas. That's taking healthcare to the last mile.
Okay, back to Mr. Samuel Udofia. One major challenge in the health sector today in the country is infodemics. There's lots of misinformation and, untrue information out there, mis and disinformation out there regarding healthcare and health systems. I'd like to know, Mr. Samuel, how do we ensure that we use this geographic information system? How do we use them effectively, just so we can curb infodemic?
Thank you very much. I think for us to ensure that geographic information system is used effectively in Nigeria, I think there is need for the spatial data infrastructure policy to be put in place. This policy is supposed to harness or harvest data from all the agencies of government, and now when all this data is being harvested from all agencies of government, it will be easy, for individuals, for organizations, for agencies, for NGOs to be able to get access to this data, and then they'll be able to make decisions from this data. Because what we have today is that geographic data is just being run in silos. Different organizations with their data sets, with their different processes and methods. But if this data is being, collected and being managed as, an entity, it will be easy for information, for decision making to be, to be taken. So that would help. That will help geographic information system, to in the health sector, so that things will run properly in the health sector. Not just individuals running as in silos. Even within the different hospitals, private hospitals, government hospitals, there is need for geographic information system to be established in such a way that all data, any information gotten from all those government hospitals, clinics, and whatever, is being managed by, let's say, a central body in such a way that, anybody looking for any kind of information, any kind of data can key into that central database, and, it will be easy to run the health sector in Nigeria.
You talked about the GIS running in silos, and then you and I are aware of the technology in Nigeria today. Just take, for example, internet connectivity, network connection, especially in rural communities. It's not easy to access some of these technological services. So how then do you think we can achieve optimum usage of GIS just so it doesn't run in silos?
Well, you see, things have actually improved recently. So geographic information system may not need to run with the internet connectivity all the time. There are circumstances where this data can be collected offline, and then after a given time, it can be synchronized into the database. So the issue of internet, yes, is there. The issue of hardware is there. But then all this can be breached if the relevant, agencies, organizations are putting in place, the necessary tools, the necessary equipment for the achievement of this particular goal.
Now back to Mr. Fashoto. I'm more particular about visualization of, the visualization objective of GIS. Now, this now brings me to my next line of question, where how do we, in using this GIS, track the sources of diseases and the movements of contagions? I'm talking about the more practical approach, just so health agencies can respond more effectively to outbreaks of disease among people by identifying populations prone to infection and targeting responses towards them.
Okay, I don't want to approve that question technically, but I don't think we can escape from that, given the question. So the real question is, how do you track diseases, right? How do you know where it is and where it's moving from? The truth of the matter is that some diseases that could be earlier detected if you actually use some of GIS processes to identify that these areas are prone to this type of diseases. And given that information, you can actually ride on that information to mobilize your team before you even have the outbreak at all. Aside that, let's take cholera for instance, where probably somebody picked up cholera vector, right, or bacteria from a particular location, and that person moves from that location to another location. Of course, because of our surveillance system, before it even gets to the system or it gets to the government, it's going to take some number of days, and the bacteria will have spread. The best way to actually approach that is understanding the terrain of that area, mapping those terrain out, and you'll be able to map areas where they are going to be prone to such diseases. And of course, there's what we call contact tracing, where you need to trace that particular person. Area of COVID back then, where people are giving phone call directly to track where they are, and also do some general assessment on whether to just stay indoor for the 14 days or come down to their facility to be quarantined. All those processes are also enhanced by GIS, because of course you need to know where they are, and then have a kind of radius. We call it radius or a buffer, to say that within 20 kilometers from this, or within 10 kilometers to this, everybody within this area should be quarantined. Right, that to actually stop that spread of that particular disease within that area. And in other areas where you even get this outbreak, you also do the same, just to curb the diseases. And of course, the challenge in that is because we are not proactive, especially in terms of disease surveillance. We are always kind of reactive. We allow it to happen, then not that we allow it to happen, it happens, then we now come up to give some processes to say, okay, not this, not that, day buffer, quarantine this, quarantine that. I think the next step actually in surveillance is to be able to predict some of these outbreak, especially some outbreaks that are very, very common to us. Yes, aside for COVID-19, which everybody agrees is an outlier because it caught everybody unawares. But every other outbreak, like Lassa fever, cholera, and some other AFP, and those other diseases, they are not new to us. So we should be able to do some proper surveillance in terms of even predicting those outbreaks before it happened, and so that we'll be able to cope that. In terms of prediction, then GIS could actually help much more in that line, and also in terms of tracking also help in that line.
Thank you so much for your contributions thus far, gentlemen. We'll go on a quick break now, and when we do return, the program continues shortly. Stay with us. Thank you so much for staying. If you're just joining us, this is the program Healthy Living on Trust Television, and we have been talking about Geographic Information System and also its application in public health. I have still on standby my guest in Lagos, Mr. Fatusho, and also Mr. Samuel in the studio, where they have been shedding more lights and insights on this particular subject. And I'd like to know, just as a way of continuation, there's no system that we introduce in the country that does not require, management, be it policy or whatever it is. Now, I'd like to know, let me start with you, Mrs. Samuel. How do we then manage this GIS? Because you did talk about the hardware, the software, and also the human component, and also the end users. How then do we manage the system just so we ensure that all of the entities are catered for?
Okay, very good. You see, we need to, when you're talking about managing geographic information system, there are different kinds of geographic information system. We have those ones which, runs on individual systems. For me, I have my individual GIS, which runs on my own. But as a country, I think there is need for us to get the enterprise GIS. The enterprise geographic information system is that which will be able to, work as, we have a central database where information will be stored, and then every other agency of government we will now use the same geographic, we will use the same system. No, that will make it easy, for the country to manage this, not, running on individual systems. If it runs on individual systems, it will make it very difficult. Or let's assume that different ministries, different agencies would want to get their GIS, to make it very difficult to manage it, to make it very, difficult for the government to monitor the processes, to monitor the, the data collection. But once it is being run as, as a unit system, run as an enterprise GIS, you see that, all the informations coming in will be able to be monitored. You'll be able to scrutinize what is coming in, and once, in terms of managing the license, the software, it will be easy for, for the government to be able to, observe and know when the license is about to expire, and then they will be able to renew it. Unlike when individual agencies, governments, is going to buy their different licenses, it will be difficult, for such, agencies to renew these licenses, from time to time.
Thank you so much, Mr. Samuel, for that answer. I understand you just talked about how different agencies need to have a centralized, say, computer servers and also configuration where there's a central system. Now, this, moving over to Lagos now, as health, earlier you talked about policy, right? How we can merge GIS and also how the policymakers can make the best use of this in decision-making policies in the health sector for Nigeria. I'd like to know first, what is the current state of Nigeria in implementing and using GIS in the public health sector? And also, what do you think or do you advise should be better in place with regards to policy formulations?
Yes, just let me take one after the other. The first thing around policy is that there have been a lot of discussion around policy as we speak. I've been in different workshops last year that speaks to having a policy document stating how GIS will be used, who is using what, the infrastructure, or how the setup is going to look like. I know there are also agencies that collaborate together with the public health. That's Ministry of Health now, that actually supports building some of this infrastructure and also training the personnel, that personnel aspect that my colleague mentioned earlier, training the personnel on how to use some of the system. So in terms of policy, there is a policy that is being pushed by the JOSIN association now. I know there are also policies back then, here and there, that is pushing for central database system and also central GIS processes, and trying to see how all these will actually work together. Now, bringing it down to public health, Geographical, we've been working with the Ministry of Health for the last 12 years, and we had a good relationship in helping them to implement some of GIS projects across board. And not just that, we also do a lot of training across board to pitch or to help with assessing the status of the people on ground in terms of knowing these applications and also knowing how to use them. So in terms of policy, I'm sure in the next 2-3 years, we might have a policy that just speaks to GIS. Although we have policy that speak to data privacy, we have policy that speak to data protection, which of course GIS architecture was to ride on that. So there are several agencies that push this policy to the house that I know they are gotten to another level in terms of reading. But so aside policies is still much more of capacity building of health workers in using this technology. That's just where the little gap is. In and out, you continue training, continue developing the skills, but at one point or the other, you just hear that person you trained has been transferred to someone else is coming in, and Oh, is much more of skill retention, especially in uh, public health. I think we need to work around that. There have been a lot of things that have been happening. Different partners have been implementing different training across board. So there's actually need to work around capacity building. But in terms of policy, I know at least due to some workshop I've attended, I know there's a lot of conversation going around policy.
I like the fact that you mentioned data privacy. And we know that for anything technology, there is always the threat of security. Now, I'd like for you to, just as a way of opening our eyes, how does the GIS system work in protection of data? Because we have seen cases where people say, maybe people in saner climes or people in Nigeria here to take advantage of these data that has been put out there, and they make use of them for whatever criminal reasons. Now, I'd like for you to put us in the right direction, how we can best protect these data, and also through the use of GIS, of course.
Yes, sure. Let us say that number one, GIS will not expose any data. At most, what they're going to see is just going to be a map of Nigeria showing different showing different analysis, or you see a map of Lagos State showing spread of one particular thing in a particular direction against another direction. So in terms of data sharing, you hardly see that actually in GIS. That's why when my colleague mentioned earlier that a lot of people have GIS on their system. Yes, it's at this point it has always been on a kind of personal run, like someone running the whole process. So for data privacy, where that really gets to apply much more is especially working with the agencies, right? And for agencies, even before you get the data from that end, there's a lot of agreement, and there's a lot of conversation that also needs to happen, and the kind of data that you actually share eventually. So in terms of GIS analytics, you hardly see GIS raw data, only if that data is publicly acceptable across board. So for data privacy, it's always maxed out. You won't see names of people on GIS data. You won't see some other information on GIS data. What majorly you see is just the coordinates, the X and Y coordinates on the data, and you'll be able to make sense of the data. So speaking to raw data, it hardly sits with the personnel. It's always from a central server to run some of this analysis, especially when you're working with public health data, because those data are very, very important and crucial to the well-being of the people. We definitely always just show or visualize some fractions or some aspect of the data, not to expose the old data itself. But data privacy actually sits with the agencies.
Yeah. Thank you so much, gentlemen. I really wish we had more time to continue this conversation, but we do hope to talk further on this particular subject and more in subsequent episodes of the program. And with that, we've come to the end of the program, Healthy Living on Trust Television. Remember, you can join the conversation by following us across all of our social media platforms, and also you can join our YouTube live stream. Until next time, I'm Aisha Salihu. Thanks for your time.